Our personality is a collection of ways that we think, feel, and behave that makes us all individuals. Personalities form during childhood, shaped through an interaction of two fractions, genes, and our environment. If you have a personality disorder, it makes it hard to live with yourself and other people. There are three main personality disorder groups: suspicious, emotion and impulsive, and anxious. A traumatic event may prompt a person to have a memory loss or confusion about personal identity or assumption of another identity. Confusion starts because they cannot remember recent events or realizes a sense of identity is missing. The remembrance of a result may result in grief, depression, fear, anger, remorse, or other states. Hypnosis is a treatment. Okay.
Agatha Christie disappeared from her home after her mother had died and her husband Archie had gone to be with Nancy Neal. She had written several confused notes to her husband before she abandoned her car with all of her belongings. She went to Yorkshire under the name Teresa Neal, and her disappearance soon made the national headlines. Archie went to Yorkshire and she said, "Fancy, my brother has just arrived," and she never spoke of this event. A man was brought to a hospital by police with no ID or cell phone. He expressed difficulty to recall details of personal whereabouts or past events. Successive mental examinations revealed improved orientation, but he failed to recall his personal identity. He remained unchanged for about 2 months until he spoke of his wife and 2 children in an examination. A social worker informed his brother, who informed them that it was his 3rd episode.
They avoid intimate and social contact with others. They are extremely shy, fear ridicule, and are over-concerned with looking foolish. They have an inferiority complex and stay in social isolation. They have trouble perceiving and relating, which causes significant limitations in relationships and social encounters. They blame others for their challenges they face and are caused by a combination of genetic and environmental influences.
He never acknowledged my presence. He got really freaky and acted like he wanted me to leave. He wore sunglasses indoor all the time with a cap pulled over his forehead. He came home around 4 to 5, headed straight for his room, and then was never heard from again for the rest of the night, except to complain about people who were making too much noise. If he was being social at all, he came across as very wimpy, nice, kind, profoundly passive, and very nervous. To me, avoidance is a defense system which protects me from other people. I don't think anyone likes me, but I desperately want them to like me. My classmates back from when I was around 12 tell me that at parties I would sit in the corner. I didn't understand what went on. I didn't understand why girls chase boys and so on. My psychiatrist has told me that my problem is that I don't act according to the feelings I have inside.
Genetics, environment, and imbalanced brain chemicals may have a role in the causes. Symptoms include social isolation, aggression, compulsive behavior, repetitive movements, self-harm, lack of restraint, delusions, amnesia, belief that thoughts aren't one's own, disorientation, slowness in activity, thought, anxiety, apathy, feeling detached from self, inability to feel pleasure, elevated mood, inappropriate emotion response, paranoia, hearing voices, depression, and fear.
After working for 6 months at a video store, Jack began to hear voices that told him he was no good. He began to believe that his boss was planting video cameras to catch him making mistakes, and he began talking strangely to customers. After a year, Jack quit his job, yelling at his boss that he couldn't take the constant abuse of being watched by the TV screens around him. He stopped taking his medication, which caused the voices and concern to become stronger. During the past 7 years, Jack was hospitalized 5 times. My brother told me about a group of coworkers who were conspiring against him. Then he started telling me that he wasn't feeling very well and that one of his coworkers had stuck him with a needle filled with a drug to take him out of the competition for top jobs. After he quit his job, he suddenly began calling me from payphones because he thought that people were bugging his phone. It took us almost 6 years until he started degenerating to the state that he had to be hospitalized.
Symptoms include preoccupation with physical appearance, seek to be the center of attention, talk dramatically, considers relationships closer than they are, easily influenced by others, inappropriately sexual, provocative behavior, rapid shifts in emotion, exhibit excessive emotionalism, which is to regard things in an emotional manner. People with this disorder are uncomfortable or feel unappreciated when they are not in the center of attention.
Marcia, at the age of 56, has constantly flirted with her therapist. She said to him, "Has any of your female patients fallen in love with you?" And, "I like to flirt. A little flirting never hurt nobody, is what I say." Her husband accuses her of being too provocative and seductive. She blames him for their problems when she says, "His rage attacks and jealousy are driving me away." Also, this has been her 4th relationship this year.
Symptoms include mood swings, elevated mood, anxiety, apathy, apprehension, guilt, inability to feel pleasure, a loss in interest, irritability, crying, hyperactivity, self-harm, rapid speaking, unwanted thoughts, delusions, lack of concentration, racing thoughts, slowness in activity and thought. Each episode usually lasts days to weeks and occurs several times a year, caused by an imbalance in the brain chemicals called neurotransmitters.
She was bullied from a young age, which caused struggling with bulimia, cutting, and drug addiction. In 2011, she entered rehab after physically hurting a dancer, where she was diagnosed with bipolar disorder. Lovato states, "For years, people said I was depressed, and I actually didn't know why I was so upset and why I would have these episodes of mania."
Symptoms include unemotional traits, disregard for others' feelings, excessive need for admiration, or social isolation. They tend to have high self-esteem that are vulnerable to criticism, generally unhappy and disappointed when they are not given special favors, and causes maybe mismatches in parent-child relationships and genetics.
Sam complains of inability to tolerate people's stupidity and selfishness as a result of his higher intellectual level. He does not interact well with others or even understand them. Sam frequently compares himself to a machine or a member of an alien advanced race and talks about himself in third person singular. Sam is convinced that people envy him. He is hurt when his loved ones become assertive and exercise their personal will. Sam has said on multiple occasions,
When a person's identity fragments into two or more distinct personalities, symptoms include self-destructive behavior, feeling detached from self, blackout mood swings, altered consciousness, depression, flashback, hallucinations, and inability to remember large parts of childhood. When children are faced with abuse, children can disassociate from full awareness, which becomes dissociative disorder.
Shirley Mason was a patient of Dr. Cornelia in 1965. One day, Shirley said to the doctor, "Hi, my name is Peggy." Cornelia injected Shirley with a true serum and found 16 different distinct personalities. The doctor questioned Shirley harshly and found that her mother had raped her during childhood. Dr. Cornelia talked to a journalist, and the two made a book that later turned into a movie called Siblings. Many of Kim's personalities are affected by Amy, her daughter, and their relationship together. For example, Dawn is stuck in the year that Amy was born and doesn't know that Amy is her daughter, but thinks she is a friend's daughter instead. She believes she had a baby named Sky that social services took away. Bonnie, another personality to Kim, was a motherly figure to Amy during her childhood.
About 1 in 10 people have a personality disorder, but many are not severe. The main treatments for personality disorders are based on talking therapies, behavioral therapies, and support services. To help yourself, try developing a hobby or interest, regular exercise, avoid alcohol and drug abuse, and lastly, regulate your sleep. Speaking up about personality disorders is a big deal and should be taken